Greetings. My name is Michael Siminovitch. I'm a professor at the University of California, Davis, and I hold the Rosenfeld Chair in Energy Efficiency. And it's a real pleasure being here today. And what I'm going to introduce and chat about is what we are calling the UC Davis Circadian Protocol. And this is a lighting system protocol that can be applied to buildings, hospitals, residential construction. And I'm going to talk about the basic principles, some of the technologies, and some of the interventions that you can be doing in your home to make your home more circadian friendly. And so what is circadian? Circadian, the actual word comes from Latin, and it means about the day. And it's the concept that the lighting characteristics of our exterior environment typically change throughout the day from sunrise to sunset. And both the color characteristics and the intensity characteristics vary throughout the day. And there's a whole new science of circadian lighting and circadian health that has originated over the last 5 to 10 years, really looking at trying to understand how this variation in light affects us biologically and how it makes us a more healthy individual. So I'm going to talk about the concept of circadian and circadian lighting as it refers to the construction of our near environments. And so this is basically a color signature of daylight. And we know that daylight is a very broad, very rich spectrum, and we all really like daylight. And we think of daylight as being a very static condition. However, daylight has got a very wide variation in terms of quality, intensity, and color. And this is really the foundation for the whole circadian concept. And so this graph is a little bit complicated, but what it does is it shows all the very spectral variations for daylight throughout the day, all the way from noon to sunrise and sunset. But what it really refers to is this, is that we've evolved under a very specific series of color and spectral conditions. For example, in the morning, very early in the morning, daylight is very rich in the amber orange region. And so our biology and our human evolution has really evolved under this kind of characteristic. However, early in the morning and throughout the day, daylighting is very white and very blue, very cool color, and very high intensity. So this is the kind of characteristic that our biology has really evolved under. And then, of course, towards sunset, we see the reversal where we start losing the blues, we start moving into the ambers, orange, and reds. And so this diurnal or daily cycle is something that our biology has really evolved very closely to. And this is, the whole term is called circadian. It's about the day. And so when you look at this all together, we see this kind of very cyclic variation in light, where we see in the morning, throughout the day, a very bright, very cool, very blue kind of lighting characteristic. And then it cycles towards evening into this very rich amber red kind of spectrum. So this cycle is very well understood, and really our biology has evolved under this, and we expect to see this as a species in order to be healthful. And so when you look at this in terms of how does this track relative to melatonin, and melatonin is really the foundation hormone that's driven by this diurnal change in daylighting conditions. And so early in the morning, we have a high level of melatonin, and then it suppresses very quickly, and it goes to a very minimum. And then towards early evening, it starts building up again, and then it peaks out late at night, and then it goes through this diurnal daily cycle. This variation in melatonin tracks very closely the intensity and color conditions of daylight. And so when we think of lighting in terms of how we light our homes, our places of work, our hospitals, It's been very driven by what we call visual pathways. And visual pathways on light refer to the idea that we can see obstacles, we have visibility, we do color rendering, we're looking at visual acuity issues. However, there's a whole secondary pathway called the biological pathway. And this is how light affects our hormones. And so the whole circadian lighting concept is that variations in light affect melatonin. And so now there's this whole science of circadian lighting that really looks at how light affects our biology and makes us happy as a species. And so what does this mean to sort of our modern construction? Well, as most people know, we are moving very rapidly to electronic light sources, LED, light-emitting diodes. And this predominates in our places of work and our home, that electronic light sources is the way that we're lighting our spaces. And so we're all very familiar with the wide variety of kinds of LEDs that we put into our homes and into our offices. This solid-state technology is very energy efficient and is basically now being used worldwide for how we light our interior spaces. So the basic guts of a LED is it's a small electronic device that makes a little bit of blue light that is then covered by a phosphor that re-emits in the visible spectrum. So the LED is a solid-state technology. It makes a little bit of UV light that makes visible light. This technology is very much driven by what's called a blue pump phosphor. So inside every light source that we have in our buildings is this little miniature blue light, and this is called the blue pump. So it makes a very rich blue spectrum as the foundation for LED technology. So again, another energy or color signature. And if the blue line here represents the color signature for a typical LED, and you can see there's a very strong peak in the blue spectrum. And this is basically LEDs work, is they make a large portion of blue. Now, the interesting issue with blue LEDs is that the peak of the LED lighting system happens to correspond with our peak circadian sensitivity. So this alignment creates some issues because basically you don't want to see blue light at night, and this can be really problematic in terms of suppressing melatonin. So a short number of years ago, the American Medical Association actually became quite concerned about light at night. We have light from our televisions, we have light from our computers, we have lights from our cell phones, which are very rich in the blue end of the spectrum. And the AMA concluded that this light at night is having a profound effect on our biology, principally by suppressing melatonin. So they declared and made a very strong statement saying that lighting at night disrupts our hormonal balance, or suppresses our melatonin, and can be quite harmful. So this was a very definitive statement from the American Medical Association, and it's really the foundation of this discussion that we're having today, is how light affects us biologically. So again, another graph, and what I'm showing here are different color signatures that suppress melatonin. So it turns out that the blue light in the shorter wavelengths is very suppressive, and it's a kind of light that we don't want to see. However, if you look at the ambers and the red spectrum, it doesn't suppress melatonin. So we can actually use this in the design of our spaces. And so this graph basically shows two things. One is it shows the kind of exposure to light that we had as hunter-gatherers and the exposure for a modern cohort. And so as hunter-gatherers, we saw a lot of light during the day, very rich blue, suppresses melatonin is what we want. And then at nighttime, basically dark. And so hunter-gatherers had a very healthy circadian lighting environment. On the contrary, if you look at the modern cohort, modern culture, we don't have so much light during the day. We're inside offices that are relatively dark relative to daylight. And then at nighttime, we're all subject to computers and televisions and to lighting in our homes. And this level of lighting could be quite harmful in terms of suppressing our melatonin. So at UC Davis, we've been looking at this, and we've been looking at how color and intensity affects melatonin, and how can we use this in terms of creating more healthful environments that more closely emulate the daylight characteristics that we have outside. So a number of years ago, UC Davis built the Honda Circadian House. And Honda sponsored the development of this energy-efficient home. And at the same time, we developed the first circadian lighting system where we explored a number of these opportunities to emulate the kinds of daylight characteristics that we normally have. So this was an experimental home that we developed, and it was actually the first circadian home in the United States. And this house included a number of different strategies in terms of energy efficiency and solar and also circadian lighting. And so we evolved what we're terming the UC Davis Circadian Protocol, which was a number of different strategies that we could put inside a home that would allow us to have a very similar daylight characteristic that kind of emulated the diurnal changes in spectrum and intensity. And so we have a whole series of recommendations for this protocol. And what I'm going to do is go through some of these strategies. And basically, it hinged on two priorities. And what we wanted to do was replicate the kinds of characteristics that you see in this photograph, where we have very bright white light during the day, and then it modulates to a much lower level at nighttime, much closer to a red-amber spectrum. So it's basically about two concepts. One is to maximize the melanopic light during the day, and that means maximize the kind of daylight component that we have during the day, and then minimize the amount of bright blue light, melanopic light at night. So basically, what you want inside a home is kind of the lighting characteristics that you see in this photograph, which is exactly what we have outside every day. So the Honda house first included maximizing the amount of daylight inside the space. And what did this mean? It meant a lot of windows, a lot of bright color, lots of white surfaces, which allowed the home to be bathed in daylight throughout the day. And so this was very good at suppressing melatonin and really allowed people to be exposed to bright white light during the day. What we also did is we put an electronic lighting system in that allowed us to emulate daylight characteristics. So on one side, we have very bright white light during the day, and then in the evening, the color characteristics of the interior would change to this very rich amber orange light, emulating the kind of light that you see at sunset. Okay. And this is just a floor plan. And what we did is we put this lighting all over the home that allowed us to have this low level of amber lighting. And throughout the home, in the evening, we put a secondary layer of light, amber light, that allowed for wayfinding. And this supports the idea that you could move around the home without a lot of bright white light that would suppress your melatonin. So the amber light allows you to keep your melatonin, but gives you enough light for visibility to easily navigate the space without being blinded and without suppressing melatonin. So it looks very nice, it's very very much like sunset lighting. We did this, for example, also in the kitchen. In the kitchen, this shows the typical daytime condition, but at the evening, it modulates over to a very low level of amber lighting. So if you were to get up in the middle of the night to go into the kitchen to get a drink, or get something in the refrigerator, you would be presented with this very warm amber light, which would allow you enough light to navigate the space, but would not suppress your melatonin. So this made the environment much more conducive to a healthy living condition. So why amber light? And again, amber light very closely emulates the kind of spectral and intensity characteristics that we see as sun starts to set. Okay? This color signature shows melanopic flux or your circadian sensitivity with the dotted line. The red line shows the color signature for amber light. And you can see there's very little overlap between these two spectra, which means you can have a lot of amber light and it doesn't have any impact on your circadian sensitivity. There's also a secondary benefit for what we call dark adaptation. And dark adaptation has to do with a visual process, is that when we start reducing the light to darkness, our eyes slowly adapt to allow us to see well at night. And you know when you turn off the lights, you can't see anything, but a few minutes later, 10, 15, 20 minutes later, you can see quite well. This process is called dark adaptation, and it sort of allows you to navigate under relatively dark conditions. But this takes time for your eyes to adapt. Now, this is very critical in our residential and our healthcare spaces. Think of, for example, navigating stairs. If it's very dark outside, trips and falls can happen because your eyes have not adapted enough to the darkness. And so this dark adaptation has to do with a visual process where you build up rhodopsin in the rods inside your eyes that gives you enough chemicals to allow your rods to be able to detect light at very low light levels. So this adaptation process, dark adaptation, is very critical for safety and navigation at night. This process can take about 20 minutes. And so this graph sort of shows you the progressive threshold ability to see at deep darkness. In this process, 15, 20 minutes, we typically adapt well to very low levels of light. And so why is this important? Well, the American family physician, this was a document that came out a number of years ago that showed, it's one of the principal issues that we have with injury is related to trips and falls. And so trips and falls are typically happening at night. They're happening on changes of plane. And this is particularly an issue with an older demographic. When the trips and falls happen, it leads to more serious health issues. So we're very concerned about trips and falls in the home. And so the issue here is that we want to be very supportive of blue cone sensitivity. And this has to do with rod function and the idea that we're not putting out light that is bleaching out the rhodopsin. And when you turn on all the lights, what happens is you bleach the rhodopsin in your eyes and you can't see well when the lights go off. And so what this really means is we want to have light in the amber red region at night that allows us to maintain dark adaptation. So again, this is why amber light works so well in these types of environments. When you light up a space at night, late at night with amber light, it preserves the rhodopsin, your dark adaptation, and allows you to visually function at very low levels of light. And so in the Honda house, what we did was we populated the whole home with these very low amber lights situated along the walls that allowed navigation, so a person could see navigating throughout the home, but also very importantly, it didn't bleach the rhodopsin. So the rhodopsin is a secondary issue to melatonin. Melatonin is about a hormonal function. Dark adaptation is about preserving rhodopsin. So this light turned out to be very useful for this kind of application. So again, we did this in the bathrooms. And if you look at these two examples, if I go into the bathroom on the left that's brightly lit, I can see what I'm doing, but now I've bleached my rhodopsin, and when I head back to the bed, I'm visually blind. So the slide on the right is the Honda house with the amber lighting. When I go into the bathroom, amber light allows me to see, but it also preserves the rhodopsin. And there's a close-up view, very pleasant light, very low glare, and it preserves, again, the melatonin, and also supports the dark adaptation and rod function. We also looked at this experimentally throughout the home. We put this into the kitchen. That allowed a very low level of amber light so a person could navigate throughout the home, preserving dark adaptation. We are applying this to hospital design and working very closely with the folks at UC Davis, looking at how do we apply this kind of circadian lighting concept to patient rooms. And we're looking at the idea, the bathrooms and the patient rooms in the new hospital of having this very supportive amber light that when a patient gets up in the middle of the night to go to the bathroom, they don't turn on all the lights. This preserves the melatonin and allows them to sleep. It also doesn't bleach out the rhodopsin, so it allows for maintaining dark adaptation, less trips and falls. And we're looking at this experimentally in terms of how can we put this into the patient room so a nurse can come into the room to do visual inspections, a patient can navigate the space at night without a lot of blue-white light. This is just looking at the bed and the view into the bathroom. This is a model hospital room where we're looking at the experimental application of amber-based lighting. And again, the general interior of the light would also marry the solar distribution. So we have very warm light in the late afternoon, very bright white light during the day. Okay. We're also applying this throughout the hospital facility, looking at the corridor lighting so that the corridors don't produce interference into the patient rooms. And so we want a daytime, nighttime mode. We want to reduce the circadian disruption into the patient rooms. And interestingly enough, it also reduces ambient noise. Okay. So this is an experimental corridor where we're working out the different spectral characteristics. And these are actual corridors where we're looking at this kind of diurnal variation in spectral distribution that supports a more circadian well environment. And this is the concept as it would apply to a hospital space where the light would navigate from a very bright white light to a much lower level amber light, creating a more supportive environment for patients. We're also exploring the concept of how this colored light affects stress. Again, this is not hormonal or circadian, but can discrete color be used to modulate stress? So stress in medical facilities is a very important concept. There was a lot of work looking at stress with COVID, and people who were under high levels of stress didn't do well. We're looking at environments like pre-op surgery. It's a very stressful kind of environment. Imaging spaces, again, very stressful. And the basic question here is, can we use color, specifically amber, would it have an effect on stress? And so we partnered with the Mind and Brain Institute, which is an institute that looks at stress. We developed an experimental room where we could introduce different colors, where we could look at this kind of diurnal change in color and would it have an effect on stress. And this is basically a color map that shows all the visual colors that humans can see. And what we did was we sampled all kinds of different colors and we looked at, does any specific color actually reduce stress? And so what we did is we had a cohort of students, we measured brainwave patterns and stress, and we introduced different colors, and we determined specific colors actually do reduce stress. And so here is the laboratory where you can actually see the monitoring equipment that we're measuring stress on students, the close-up view. And a little bit complicated graph, but basically what we showed was the amber spectra had a very significant impact on stress recovery. So when students were exposed to amber light, they more quickly recovered from stressful events. And so this actually makes some evolutionary sense. And so I always look for evolutionary analogs in terms of how does light and color affect our well-being. And if you think of the variations of light, again, throughout the day, we have this whole concept called golden hour. And this is, as sun sets, it starts modulating into this red amber, and our whole sort of physiology calms down. And so we're basically wired to see this. And when we see amber, it's very calming. And so the explanation is that we looked at this experimentally and we showed that yes, golden hour type quality of lighting actually does reduce stress. And we think that there's a good evolutionary argument on this because of this. So you think of these kinds of scenes, it's basically the characteristic of light is moving towards this red amber. And we expect to see this, so that our biology has evolved under this. Our body's starting to wind down, we're starting to relax. And so we're really looking at this as an interesting example. Also, culturally, we've evolved with the idea that fire, is kind of a calming influence. We've all sat around the fireplace and sort of been very soothing. And so we think that there's a very interesting relationship there with color and stress. So we've been working on how do we make this available to the general public. And what we've done is we've designed and developed what we're calling the Davis lamp, which is a lamp that you can have at home that will allow you bright white light during the day and this kind of amber orange light at night to help you see, but also to support stress. So we're in the process of commercializing this. And the Davis lamp allows for a very good color, gives you an amber spectrum for stress. We've actually measured this and we've looked at the amber spectrum, and it is actually very efficacious in terms of reducing stress. So at night mode, it has very low melatonin content as well. So this will also support your circadian wellness with the idea is you start moving and modulating into a richer, more amber spectrum. And again, I'm sort of showing the diurnal variation on this. The sunrise, sunset picture is how our biology has evolved and how it supports us in terms of melatonin and also in terms of rhodopsin. And what we're doing is we're developing technologies that allow people to put this into their homes. So what is it that you can do today in terms of a home intervention that would allow you to support a more circadian, healthful environment? And so this photograph shows a sort of a very typical kind of home situation that can be created relatively easily and at low cost. And so we have a whole series of variations on what's called the Circadian Protocol, but I'm really just going to focus on the amber protocol. There are low-cost amber strip lights that you can purchase to wire your home inexpensively and safely with an amber spectrum that will support this. So for the handy person, this can be introduced relatively easily, typically in the toe kicks in the bathroom and in the kitchen. And this shows a very simple retrofit that can be done in a kitchen environment. And this can be sensor-based, which will allow the light to modulate according to presence. This shows the toe kicks in a retrofit in a kitchen where amber light is introduced to provide a very low level, very soothing, very calming light for nighttime navigation. This is very inexpensive and very easy to do. The picture on the left is the Honda house where we used a commercially available fixture with an amber distribution to create this very specialized home environment. But you can do this easily at home today because there are quite a number of commercial technologies that simply plug into an existing socket that give you an amber light distribution that has greatly reduced blue content and white light. This will support navigation throughout the space. It won't suppress your melatonin, or it won't bleach out your rhodopsin. This is a very easy intervention that can be done today very inexpensively. These technologies are broadly available. They simply plug in. Some of them are sensor-based. They use very low levels of energy. So when you come into a room, these things will pop on. When you leave, they'll turn off. And it provides the right type of light distribution at night without a lot of blue-white light, which is what you do not want at nighttime. This shows a more commercial kind of fixture that's a wall insert. This requires a little bit more of a sophisticated approach, but definitely something the homeowner can do. One of the easiest things that you could do is an under-bed nightlight. These are commercially available technologies that very easily attach under the bed. They are sensor-based, so when you get out of bed at nighttime, this amber light will come on. This will give you enough light to leave the room and come back in, and then we'll switch off after a preset amount of time. These are widely commercially available. They're being used in hospitals today, and it's a really great idea for children, for adults. Under the bed, it's a very high quality of light at night. These plug in. They can be also, some systems will allow you to modulate the amount of light in terms of the intensity. And with a sensor-based system, will turn off after you've come back to bed. So this is one of the most practical, easy retrofit solutions that you can do today. So I thank you for the time today, and I appreciate you looking at this seminar, and you're more than welcome to reach out to me at the California Lighting Technology Center at UC Davis, and thank you for your time.